Hello and good morning, everyone. My name is Apu and I'm the Injury Prevention Officer here at Injury Matters. And I'm so excited to be facilitating this webinar today, which will look at different injury prevention areas here in WA. Just a note today that one of our speakers, Shannon Maguire from the Aboriginal Health Council of WA, cannot be joining us today. So just letting you know, we have 3 amazing speakers lined up as well. So stay tuned. Before we start, I'd like to acknowledge the traditional custodians of the land on which I'm facilitating this webinar today, which is the Whadjuk Noongar land. So I'd like to acknowledge the Whadjuk Noongar people, who are the traditional custodians of the land on which I'm presenting, and as well as their elders past and present and the leaders emerging. Australia always was and always will be Aboriginal land. I'd love to know where you're all tuning in from today, so please use the chat box to acknowledge the traditional custodians of the land you are tuning in from. Just to go over a few housekeeping points, can everyone please double check that their microphones are muted? This will allow everyone to hear the presenter clearly. We'd love to hear your questions, so we strongly encourage you to please send them through in the Q&A box, and we'll go through them at the end of all of the presentations. If you have more than one person in the room with you today listening to today's webinar, we would appreciate it if you could please send us a quick private message just to let us know how many people are listening in with you. If you face any technical issues during the webinar today, just let us know and we'll do our best to help you with it. And also this webinar is recorded. So a bit about Injury Matters. We are for safer people and places. Injury Matters aims to prevent and reduce the impact of injury within the Western Australian community. We do this through advocating and providing education for injury prevention, as well as providing support for people who have been impacted by injury. Today's webinar is delivered via our No Injury program with the support of the WA Department of Health. No Injury is a statewide program which aims to enhance the capacity of injury prevention and safety promotion practitioners to deliver quality injury prevention activities. Via the No Injury program, we provide training events, resources, and networking opportunities to support injury prevention across the sector. Given the diversity of injury in WA, the program involves a variety of injury topics. However, today we're focusing on injury prevention broadly in WA. So what is injury? Injury is the physical or mental harm to a person resulting from intentional or unintentional contact with an object, substance, or another person. The burden that injury places on the healthcare system through disability, premature death, and trauma makes injury a serious public health concern. So let's look at some stats in WA. Over 3 people die every day due to an injury-related incident. 1 in 6 people report an injury that required treatment by a health professional every year. Injury has a leading underlying cause of death for individuals aged 1 to 54 years. The impact that injury has on all Western Australians reinforces the importance of focusing on the preventable and predictable nature of injury and the need to make injury prevention a priority. Also, the wide range of health areas within injury contributes to the need for an integrated approach to injury prevention by a range of health sectors. Today, we will be hearing from leaders within the injury prevention space on topics that range from drowning prevention to alcohol harm reduction to child health and injury. We'll be hearing from Rachel Murray on drowning prevention from the Royal Lifesaving WA. We'll also be hearing from Kristen Jameson on child health and injuries from Kidsafe WA. And lastly, Julia Stafford from Cancer Council WA, who will be talking a bit about reducing harm by cheap alcohol. So I just wanted to introduce and hand it over to our first speaker for today, Rachel Murray from Royal Lifesaving.
Great, thanks, Apu. Now let me just get this up and we'll get started. So thanks everyone for having me along to speak today, and thank you for coming and prioritising injury prevention in your work. It might be a major part of your work or maybe just a little bit of something that you do, but I think it's a really important and often under-recognised issue. So we do appreciate the time that you're taking in attending. I'd also just like to start by acknowledging the traditional custodians of the land from which I'm presenting, which is also the Whadjuk Noongar people, and pay my respects to their elders past and present. I just want to talk a little bit today about drowning prevention. So I guess just starting with what the problem actually is, some of the key stats and trends that we do see, along with some of the programs and campaigns that we have available in the community to aim to prevent this issue. So very briefly about our organisation, the Royal Life Saving Society WA. We are the leading provider of water safety education and training in Western Australia. We've been around for a long time, and we have trainers and instructors and staff based all across the state. Ultimately, we are all about empowering our community to be safe in and around water and trying to prevent drowning within the Western Australian community. So when we talk about drowning, often people do tend to think automatically about fatal drowning, and that does tend to be the sort of first thing that comes to mind. But in fact, drowning is a process. So we really focus on the whole spectrum of drowning. That can include, of course, those fatal cases where someone didn't survive, as well as situations where they may be rescued before it gets to that stage and have a non-fatal drowning, but there may still be injuries that occur as a result of that. So even if someone survives a drowning, there can still be really serious injuries that can persist for life, particularly around brain injuries, and we most commonly see those in children and young people. So we're really about preventing the whole spectrum of drowning in the community, and we do try through our research and information that we promote to make that very clear and to reflect that whole spectrum of drowning. So I just wanted to include a few sort of key stats and things that we do tend to see. So over the last financial year, we had about 300 drowning incidents recorded. This, of course, is often an underrepresentation. We know that we don't get the full burden of particularly those non-fatal cases, especially situations where people may only present to the emergency department and don't sort of progress further in the system. So we know there's probably many more happening every year. Last year, we did actually see that number 39 fatal drownings was quite an increase from previous years. So that is obviously an area of concern for us. But you can see, of course, that the major burden is within those hospital admissions and emergency department presentations as well. Often, actually almost exclusively, we do see that males are more at risk of drowning. That is across the entire lifespan, pretty much from birth to old age. We do see that men are highly overrepresented in drowning statistics, of course, because they often tend to be participating in some of those more high-risk activities around water. So things like boating and fishing that do tend to put them at more risk. We also see that people in regional WA were nearly twice as likely to drown last year than people in metropolitan Western Australia. That can be for a number of reasons: exposure to different types of water bodies, access to emergency care as well. If they're a long way from help or there's no mobile reception, it can make those kind of responses more difficult. And when we look at different age groups, we do see that children under the age of 5 are consistently at the greatest risk of drowning. The numbers have gone down quite a bit over the years, but as far as that risk, they have retained that. And we have also seen kids in the 5 to 14-year age group and adults over the age of 65, which does sometimes surprise people, but we do very consistently see that those older adults are actually quite higher risk. And unfortunately, as with many injury issues, people who were born overseas, who may be here as a tourist or as a migrant, and Aboriginal people are all overrepresented in drowning data as well. So just a few final kind of key things that we saw in the last financial year. Unsurprisingly, coastal locations, so either essentially out at sea or from the beach, are the top drowning locations for that year, as well as rivers and creeks, so some of those inland waterways that may not sort of be the first thing that comes to mind for you. Top activities people were participating in at the time of drowning, again, no surprise, swimming, boating, and recreating around water, which often means that they weren't actually in the water. That could be a child who'd been playing around a swimming pool who's then fallen into it, or an older adult who's fallen into water, tends to be in that sort of recreating area. And the biggest contributing factors that were identified through the drowning cases were environmental factors about there was rough water, bad weather, things like that might have made it more dangerous. In older adults, pre-existing medical conditions is a big contributor. So that includes things like particularly cardiac conditions that may be the sort of precipitating cause that then leads to them being in a situation where they're potentially unconscious in the water or unable to get themselves out, that ultimately results in a drowning. And across a broad spectrum of ages, we do also see poor swimming ability as unsurprisingly being a factor as well. So having said all of that, the good news is that drowning, of course, like a lot of injuries, we believe can be prevented. And so we direct all of our activities through or consistent with the Australian Water Safety Strategy. So this was released a couple of years ago and is really what we're sort of working towards for 2030. So this is a national strategy that identifies high risk people, locations, water-based activities, certain population groups, and sort of risk factors for drowning. And all of the strategies that we use really do tend to target one or more of these guiding principles that have been identified. So when it comes to the spectrum of drowning prevention, there are a lot of different ways that we do try to prevent these injuries from happening, which range from education. So that's what our health promotion team here at Royal Lifesaving works on. That's what I'm involved in, is really about that community awareness about what the risks are, how they can prevent drowning, and how to behave safely around the water. We do also have a lot to do in this area with actually developing skills. So, we mentioned, of course, that poor swimming ability is a major contributor to drowning. And of course, what we're trying to do to ultimately prevent that is giving people the swimming and rescue skills, survival skills, so that if something does go wrong, they have got those practical skills to potentially save themselves or to assist someone else in an emergency. At a broader level and at a more societal level, we do also have policy and legislation. So things around home pool barriers are a really big area there. Things like compulsory life jackets, safety equipment that's required on boats, all of those are there at that sort of state or higher level to encourage safe behaviours. And finally, we can do things to design and monitor different aquatic environments to encourage participation in safe places and also reduce some of the risks. And as an organisation at Royal Lifesaving, we do sort of work across this whole spectrum of drowning prevention strategies. I just wanted to go through and I guess touch a little bit on some of the specific programs that we do offer and campaigns around this area. So we have programs which are targeted at different life stages or different parts of those strategies that we've just looked at. So the first of these that I'll mention is Keep Watch. And so, of course, we saw that children under the age of 5 are at greatest risk of drowning compared to anyone else in the community. So Keep Watch has been delivered by Royal Lifesaving in WA and nationally for well over 20 years now, aiming to prevent those childhood drowning deaths. So with this program, it is very much targeted at parents and carers of young children, as well as health and community professionals who are working with those groups. So people like child health nurses, play groups, community health or community organisations who are in that position to be able to pass information on to parents and families as well. And we promote 4 key messages. They're primarily targeted around the home environment, which is where we do see young children tend to be most at risk. Ultimately, when it comes to the safety of young children around water, supervision is the most important thing, but we do also recognise the value of restricting kids' access, so through things like pool fencing, teaching children water safety skills, and for parents to learn how to respond in an emergency. So this program is primarily an education and awareness campaign. We have media, we have direct community education, and we do also do a lot of work in professional development with some of those groups who are in that position to pass information on to parents as well. We also have, for our young people who we do unfortunately see are at quite high risk, our Be a Mermaid campaign, which is very much encouraging young people to recognise and kind of call out their friends' behaviour around water, particularly in regard to risk taking. So for quite a long time, this was really focused on alcohol specifically. So you might remember the Don't Drink and Drown campaign, which was sort of run for quite a long time. That's now been broadened out quite a bit further to recognise some of those other risk-taking behaviours and things around environmental factors, going with other people, and of course still not indulging in alcohol before drinking. Again, this is that community education and awareness. We do run a media campaign, and we do also do a lot of school and community engagement directly with young people. We go down to leavers each year to spread the messages to those graduating Year 12 students. So it's really trying to encourage young people to recognize those risks, but while it's not so much telling them, don't do these things yourself, it's really about saying, look after your friends, do the right thing in those situations, and ultimately, be a mermaid and help your friends out of those cases. Now, we did also see that older adults are often for people surprisingly high risk of drowning. So we've more recently, over the last couple of years, introduced our Make the Right Call campaign. It's broadly targeted at adults over the age of 45, but we do have a focus on the sort of upper end of that age group, so the over 65s. And this looks at participation in a range of aquatic activities with some key messages around recognising environmental factors, recognising their own potential limitations from things like medical conditions, that, as we saw, were often quite a high risk, using appropriate equipment, so things like life jackets on boating and fishing, we've got quite a big focus on that. And again, knowing how to respond in an emergency, learning CPR and learning rescue skills. As part of Old for New, we do also have a program which is the Old for New life jacket. As part of Make the Right Call, we've got our Old for New life jacket upgrade, where we essentially encourage people to surrender their old, obsolete, often very well-used life jackets, and they can then purchase new inflatable styles for a heavily reduced price. So we're really trying to not only encourage that behaviour of wearing a life jacket, but also enabling that through helping people to acquire the appropriate equipment to make that easier. And something, I guess, a little bit different is our Watch Around Water program, which is very specifically based in aquatic facilities, so public pools and aquatic centres. This came about, again, nearly 20 years ago, when we did see a number of children fatally drowning in public pools. And so Watch Around Water is really a centre policy. So aquatic centres across Western Australia are registered as part of the program, and they have very specific policies in place around supervision requirements for parents or carers. And so we support that through a range of resources and training for staff. And it's really encouraging people to remember that lifeguards aren't babysitters. They're there to sort of, care for the whole facility, but of course, as parents and carers, we've got that role looking after the children specifically in our care. So since Watch Around Water was introduced, I think in about 2004, we haven't seen a fatality of a young child at an aquatic facility in Western Australia. There have been some in other states, so it has been a really successful program in that way. Now, of course, a lot of that is in that sort of education awareness side of things, those broad community messages. But of course, we do also deliver direct skills development and education. So we've got a number of programs which range from our infant aquatics, which is about introducing babies or toddlers to the water, starting to learn some of those basic water familiarisation skills. That then progresses onto our Swim and Survive program, which, a lot of people, even some people on this call may have gone through that process of learning swimming and water safety skills, potentially all the way up to our bronze rescue, culminating in the bronze medallion. So those are more focused on higher level survival and rescue skills. So these programs, of course, are delivered at a range of aquatic centres and swim schools. We do also have some very targeted programs for populations that we know are more at risk, who may be less likely to access some of those swimming and water safety skills. So we have targeted programs for Aboriginal children, particularly in regional and remote communities. We do also work directly with a lot of multicultural communities, both to do lessons for young children who may not otherwise access them, and for adults. So, of course, for people who may have migrated to Australia who haven't had exposure to water necessarily, particularly for women from a lot of different cultural backgrounds, swimming may have been something they've never participated in. We do have adult swimming lessons, which are designed specifically for women's only or men's only groups. They start at a beginner level and they give people that opportunity to learn the basics in a really safe and supportive environment. And that's something that's really grown over the last few years, and something that we see as a very big priority for our swimming and water safety education. Is it's about bringing the opportunity to learn those skills to people who may not otherwise get to do that. Now, all of our programs are underpinned by research and data. So some of this from Western Australia, some of this nationally. So we do annual drowning reports. We do a lot of program evaluation, which is sort of both internal and shared externally. We also do a number of research projects on sort of specific water safety issues. And we do work quite closely with the aquatic industry as well to look at how that's working and ways that we can improve in that area also. So we do, as you can see, work across quite a broad spectrum of areas. We're always looking for new opportunities as well. So if there is anything that sort of piqued people's interest that you'd like to learn more about, more than happy for my details to be shared and to get in contact so that we can talk about future opportunities. But otherwise, I think that's probably just about time. So I'll wrap up there. Happy to take any questions now or later as well. That's it.
Thank you so much, Rachel. We'll take questions at the end, but I do encourage everyone to pop your questions into the Q&A box below if you have any questions for any of the speakers. So I'll move on to Kristen Jameson from Kidsafe WA, who will be talking about child health and injury.
Thanks, Abu. I'll just share my screen. All right, hopefully everyone can see that. So yeah, thanks everyone for joining us this morning, and thanks to Apu and everyone at Injury Matters for organising this event. It's always a good opportunity for us to let everyone know what we're doing in this space at Kidsafe, and also just to hear what other organisations are up to in the injury prevention world. So today I'm just going to be giving you a bit of an overview of childhood injury in Western Australia and how we at Kidsafe WA can support professionals who are working with children, parents and carers in their roles. So before I begin, I'd also like to acknowledge the Whadjuk Noongar people as the traditional custodians of the land that I am on today. While our Kidsafe WA office is located in West Leederville, I'm joining you from my home today, which is in the city of Canning on Noongar Butcher. I'm very lucky and honoured to live and work on Noongar land, and I appreciate the connection that Aboriginal people have to water, the land and community as well. So for those of you who are not familiar with Kidsafe WA, we are a non-for-profit organisation dedicated to promoting safety and preventing childhood injuries and accidents in WA. The reason that we exist is that unfortunately more children die from injury than from cancer, asthma and infectious diseases combined, and injuries are the leading cause of death in Australian children aged 1 to 14. Specifically in WA, we see 24 children die every year from an injury. Over 8,000 children are hospitalised, and we have around 35,000 children presenting to an emergency department in WA for an injury. And most of these injuries that we do see are preventable, which is why we are running our programs at Kidsafe WA. So our aim at Kidsafe WA is to prevent childhood death and injury and reduce the severity of injuries to children through education, advocacy and research. We obviously know that injuries can happen and do happen to all kids as they grow up, but we just want to make sure that they aren't at risk of those more serious ones that are happening. To start off with, I'm just going to go over some quick statistics on childhood injury in WA. So these stats are all from a recent research report that was produced on injuries to children in regional locations. So we also include data from the Perth metro area in this report. If you are tuning in today from a regional town or are wanting some more information on region-specific data, you can access that report on our website or through the link. So the data for this report was obtained through the epidemiology branch of Department of Health WA and also the Perth Children's Hospital Emergency Department Injury Surveillance System. So between 2011 and 2015, there were 116 recorded injury-related deaths in children residing in WA, which is approximately 24 per year. On a positive note, this did reduce from 27 injury-related deaths in the previous reporting years of 2001 to 2010. Children under the age of 5 account for the largest number of childhood injury deaths relating to injury, followed by children aged 10 to 14. And you can see on the graph that's on the screen there now, we have the leading cause of injury-related death as transport accidents, followed by drowning, self-harm and assault. Over that same 5-year period, we had 40,015 children hospitalised in Western Australia for an injury, which is roughly is about 8,000 per year. And unfortunately, this has increased from around 7,000 in that previous reporting period. So similar to the death data, children aged 0 to 14 account for the highest number of injury-related hospitalisations. Of children hospitalised for an injury, 61% were male and 39% were female. So quite similar to Rachel's stats on drowning, we do see males accounting for more injuries than females. So this graph shows the leading cause of hospitalisations in children, with falls being the #1 cause. Some of the other causes that we see: mechanical forces, transport accidents, poisoning, burns and scalds. There's quite a few that you can have a look at there. So during that same 5-year period, we had 90,000 children present to the Perth Children's Hospital Emergency Department as a result of an injury, which equates to about 18,000 per year. Although there are a number of paediatric medical facilities in Perth, in the Perth metro area and across WA, we know that PCH is often considered the reference centre for paediatric illness and injury for the state. So again, similarly to the hospitalisations and death, children under 5 accounted for the highest number of injury presentations, followed by children aged 10 to 14. And again, you can see there that males did present quite a lot more than females there. So with those stats in mind, I'm just going to go over the services that we currently provide at Kidsafe WA and just how we can support you in your role if you're working with children or parents, carers or any communities, just how we can help you to get injury prevention for children into that as well. So we mainly have 3 main program areas at Kidsafe WA of home, road and play. And we work with parents, children and carers on staying safe at home, road and play. And we do this through education, research and advocacy. So firstly, looking at our home program, we know that the home is the most common location for childhood injury to occur, with children in that 0 to 5 age range being most vulnerable. We also know that parent and carer behaviour plays a vital role in injury prevention for young kids. When they're at that age, they really rely on their parents and carers to provide that safe environment for them. So in this program, we have our parent and carer education workshops, which we currently have supported by the WA Department of Health, and we can offer these free of charge to any community groups. We currently run them in the Perth metro area to new parent groups, childcare centres, anyone where they have lots of parents gathering together in groups already. We come out there and deliver a short education workshop on all of the common injuries. We have our primary school education incursions. This was for year 1 to 3, but we've now done this for kindy to year 6. So we can come out to your school and deliver a 1-hour session to kids about injuries and what they can do to keep themselves safe. We run injury-specific webinars. We try to focus on new topics of new emerging issues. But if there is anything that someone is interested in, we're more than happy to look into a certain injury and provide webinars on that topic. We have our safety demonstration house in West Leederville. So this house offers a walkthrough experience for parents and carers. and it just provides, or it highlights potential childhood injury hazards around the home and methods for prevention to make sure that we're providing that safe place at home. We have a range of home safety resources. We have a parent's guide to Kidsafe homes, Kidsafe farms for anyone in regional towns. We have lots of different research reports and fact sheets on all different home injuries. Our road safety program is mainly our child car restraint fitting, hiring and advice service. So we have a team of qualified fitters that will check or fit car seats for parents or carers or childcare centres, anyone that's transporting kids. And we also have a hiring service, which is a really good option for parents that might be have family travelling or visiting. They need an extra car seat, or they might just need a short-term option if they're looking after someone else's child. So we do hire car seats from our centre in West Leaderville as well. We have our Hot Cars Awareness campaign, which is basically just an education campaign to educate the community about the dangers of leaving kids in hot cars. You can see on the screen there, we have these little signs that we print up for car parks, just as a bit of a visual reminder for parents when they are dropping off kids anywhere to not ever leave kids in their car. We have the Child Car Restraint Best Practice Guidelines. So this was updated last year by Kidsafe Australia and Neura. And it just provides a best practice guide for the use of child car restraints. There are some laws in Australia that we provide further best practice guides on. So for one example, the laws with having children in the front seat of the car. In WA, it is legally 7, but we promote that children should stay in the back seat and they're at least 12 years old. Just when they're a bit bigger, they're not at risk of an injury from that airbag in an accident. We have a range of road safety resources, again, a parent's guide to Kidsafe roads, which is all about child car restraints, pedestrian safety, kids walking to school, everything to do with road safety. And we also offer registered training as well. So if you are looking to become a child car restraint fitter or technician, you can do that training through us. It's a really good option if you're in a childcare centre or working with parents regularly. You can then check their car seats and make sure they are fitted correctly if they're attending your service. So just on our child car restraint service, you can book these appointments online. They're roughly 30 to 60-minute appointments with a trained car seat fitter. They take the parent or carer through the seat and go through all the different features of it and make sure that it is fitted correctly. On average, with our stats from our service, we see about 44% of car seats incorrectly installed or incorrectly adjusted for the child. So we know how important it is to have a correctly fitted and adjusted car seat in the car. So we just offer that sort of education and advice around car seats for parents. We do have a fee for this service. It starts at about $25 just for a standard check. If we are coming out to you with our mobile service, it can go up to $65 per seat, obviously if we're travelling around Perth to get to you. We currently run this from our office in Kidsafe WA, in West Leaderville. We are at Joondalup Bunnings every Friday, in the city of Melville on Tuesdays. And we also have that mobile service if we can have a car seat fitter come to the parent's location and to check the car seat for them. If you are an organisation that has lots of parents attending your service, if you're from a childcare centre, child health nurse, anyone with that regular contact with parents, we can actually organise for a fitter to come out to your organisation and be there for the day. And we just charge for the fitter per hour. We get through as many car seats as we can. And we just run a bit of an education session with the parents there, all about child car restraints and road safety. So we also have our play program. This is all around making sure that we are providing fun, safe and challenging playgrounds for kids. We do have Australian standards for playgrounds, which provide a best practice guideline to make sure that playgrounds aren't providing any hazards. They're definitely not there to provide risk-free environments. We know that kids need that risk and challenge in those when they are playing. So as part of this, we run a playground consultation, design and inspection service. So we can come out to your playground if you provide a playground in your service. We do a full inspection, make sure it does comply with the standards. There's no hazards that we can see, and then we give you a written report to highlight any issues and how to rectify them. We do consultation and design. So if you're looking to put in a new playground in your service, we can assess the plans, go through everything with you of how to best utilise the space and provide those challenging environments for kids. We have registered training in this as well. If you're looking to become a playground inspector, that's a big part of my role, and it's a very, very good part of my role. You get to go out and have a look at all different playgrounds around Perth. and see what environments are going to provide those learning opportunities for kids as well. We have local government inspection and training packages. So we currently have a few contracts with local governments where we go out and inspect their playgrounds on a regular basis, just to make sure that there aren't any new hazards, or if they're replacing larger playground equipment, we can help them to, again, best utilise the spaces that they have. And we do have an upcoming event later in the year in August, which is our second symposium that we're running. So this is all around pushing the boundaries in play. We have a range of guest speakers that are going to be there, talking about how they've provided playgrounds in their organisation and their space, and what we can do to just provide more of those environments for kids. So if you'd like more information on that, we do have the link to buy tickets and everything on our website, which will be in the slides later on as well. With our Aboriginal and Torres Strait Islander communities, we do have specific resources, but we are at the very start of our reconciliation journey. So we're in the process of developing our Reflect wrap. We are in the very early stages, but we are looking to collaborate with any organisations in this area. We travel out regionally to different communities, and we just would love to get involved with more Aboriginal communities and organisations to see how we can tailor our work to these communities and make sure we have more resources. And also with our multicultural communities, we have translated some of our resources. So we currently have our animations on our website on road safety, burns and scalds, and falls. So we've now translated these to have translated captions, and we have our fact sheets around home safety and our home safety checklist, which has been translated to Vietnamese, Chinese, Korean, and Arabic, which we do have all these on our websites as well. With our regional and remote communities, as I said, we do travel out to each region of WA annually. We haven't been able to do this for about 18 months now with COVID, but we've just started to plan a few more trips for the rest of the year. In the past, we've gone out to each region for about a week at a time and just delivered our standard services of our home, road and play. But we are looking to sort of change this up a bit. And as we go out to each region, we want to work more with the community that's already there, see what services are currently in place for child injury prevention and how we can offer our services and best utilise that with the community that's already there. So we've got some upcoming trips. We'll be in the Wheatbelt in August, the Kimberley in September, and Pilbara in October. You can go onto our website and fill out an expression of interest form if you're interested in having our services in your town. But otherwise, you can just email through an email to me and we can go from there. Underpinning all of our programs, we do have a range of research and injury surveillance to highlight prevalent childhood injuries. And this is in conjunction with Perth Children's Hospital. So every year we produce 4 bulletins and an in-depth research report and an annual data report on all of the injuries that we do see. So some of the recent topics that we have looked into is injuries in children in regional locations, intentional injuries. We are slowly looking to sort of investigate intentional injury and that burden that we have that it has on kids, and not just those accidental injuries. So we've just started with a bulletin on this data from Perth Children's Hospital, but again, that's something that we're looking to work on and expand our services into. We also sit on a number of advocacy networks. We chair the WA Consumer Product Advocacy Network, which is all around product safety. They highlight any emerging injury issues that are associated with products. So if you do come across any products that parents might be concerned about or you've seen concerns around, you can flick through an email, and they do sort of, they meet once every 2 months to sort of discuss any emerging trends with product safety. And the next report that we have coming out is a small wheel device injuries report, which goes into the new e-ridables legislation as well. So that is basically everything for me. It's a bit of an information overload, but if anything has struck your interest there, the best way to get in contact with us is just to flick through an email or visit our website. As Rachel said as well, we're always up for opportunities to work with other organisations. We can be very flexible with our services and tailor something for you and your needs. So yeah, please do get in touch afterwards or ask any questions in the Q&A box. Thanks, Sophie.
Thank you, Kristen. That was great. A lot of information there, though. Very useful. Thank you. And I'll move on to our last speaker for today, who is Julia Stafford. Julia Stafford is from Cancer Council WA, and we'll be talking about reducing harm by cheap alcohol. that's an area that she's working on. Go ahead, Julia.
Thank you so much, Apu, and good morning to everybody. I hope my dog's snoring loudly behind me isn't too distracting. He's found the session very relaxing so far. Okay. Here we go. Is that all right? You can see the...
We can see your presenter view, which is with the notes.
Ah, there we go. All right.
The 3 dots at the bottom.
3 dots,
yeah.
yes.
There you go.
That's right. You did teach me that. Thank you. All right, here we go. So yes, my name is Julia Stafford. I'm the Alcohol Program Manager, and so today hoping to discuss alcohol-related injuries in WA and the contribution of cheap alcohol to harm, and preview some of our upcoming activities that are really designed to create an enabling environment for the WA government to continue to act to prevent harm from alcohol. So, like the other speakers, I would like to acknowledge the traditional custodians and owners of the land. I'm also on the land of the Wadjuk people from the Noongar Nation, and I want to recognise their continuing connection to land, waters and community. So just a little bit of background to the alcohol programs team at Cancer Council WA. We work to inform community discussion about harm from alcohol and the impacts of alcohol on the community, with a particular focus on alcohol as a cause of cancer. So we cover a whole range of alcohol-related issues, but today I'm going to focus a bit more exclusively on cheap alcohol price. Really over the last couple of years, we've seen what a difference it makes when governments put health and wellbeing of the community first. They've really saved thousands of lives through the health response to the COVID pandemic. But when it comes to alcohol, there's much more that can be done to prevent the growing harms fueled by alcohol in our community. And so while harms from alcohol have been ongoing for quite a long time, the pandemic has had a significant impact on alcohol-related harms that the community experiences. The Cancer Council is concerned about alcohol, particularly because alcohol is classified as a Group 1 carcinogen. There's no doubt that alcohol causes cancer. And alcohol is a cause of at least 7 types of cancer, including cancers of the mouth, pharynx, larynx, esophagus, liver, bowel, and breast. And it's estimated that alcohol causes over 550 new cases of cancer in WA each year. Alcohol also causes a whole lot of other harms, and I'm going to talk a bit more about those shortly. So if you watch the news or you read the paper, then you'll know that our health system is under pressure, and alcohol-caused harm is contributing to that pressure. Each week in WA, there are around 8 deaths and 402 hospitalisations that occur related to alcohol use. Our hospital and emergency departments are stretched, and WA has one of the highest rates of emergency department presentations due to alcohol in the country. Also, if you watch the news, you'll see that our ambulance services are under pressure. An average of 16 ambulances per day are called out to attend to Western Australians for the primary reason of alcohol intoxication. So 16 ambulances per day just for alcohol intoxication. So really the tip of the iceberg, and that number has increased over recent years. Alcohol is one of the highest risk factors for injury. It contributes to 15% of the overall burden of injury. It increases the risk of violence, intentional self-harm, road crashes and drowning. So very much connected to the topics that Rachel and Kristen have covered already today. So 74 people died in WA waterways due to alcohol in the 10 years to 2020. So, you know, covering a whole range of injury areas. And especially alarming is alcohol's contribution to rates of family assault. So while alcohol does not cause family and domestic violence, alcohol products contribute to the likelihood of family violence occurring and the severity of harm that results from violence. And last year, WA Police attended more than 25 alcohol-related family assault incidents each day. So huge numbers there. Alcohol harm costs the community, and responding to alcohol harms costs the community over $3.1 billion per year, just in policing costs, hospitalisations, road crashes and ambulances due to alcohol. When you look at both the tangible and intangible costs of alcohol, the annual cost of alcohol to Australian communities is estimated at $67 billion per year. And that really dwarfs the alcohol tax revenue that governments receive of about $8 billion per year. So we've got an estimated $67 billion in the costs of alcohol use, and the government receiving about $8 billion a year. So I'll focus more exclusively on the problem with cheap alcohol. So very cheap alcohol products represent just a small fraction of the products for sale, but they account for a really large share of alcohol harms. Fierce retail competition has led to aggressive discounting of alcohol products. So you can currently buy alcohol products for as low as 26 cents per standard drink. So that might be less than $3 for a bottle of wine, or less than $10 for a 4-litre cask of wine. So when I'm talking about cheap alcohol, that's the kind of cheap alcohol we're referring to, and it's unfortunately too available in WA. So we know that really cheap alcohol comes at a cost to our health, to our communities and to families. And the lower the prices get, the higher the impacts on the WA community. So alcohol products at the bottom end of the market tend to be targeted at high-risk drinkers and sold to them in dangerously high volumes. The heaviest drinkers typically pay less per standard drink compared to lighter drinkers. And we know young people are particularly sensitive to the price of alcohol, and young people who drink at high risk pay less per standard drink than lighter drinkers. Recent research found that cask wine was one of the most common main drink types among the heaviest drinking 10% of the population. And they also found that the heaviest drinking 10% of the population drank almost 55% of all alcohol consumed. So alcohol use is not evenly spread across the community. It's very much skewed towards the heaviest drinkers, and it's those drinkers that these very cheap alcohol products are targeted to. The growth of online sales and home delivery of alcohol can compound this problem. So cheap alcohol bought online may increase the potential risk of alcohol-related injury. So the good news is that harm from alcohol is preventable, and there's robust evidence about what works to prevent harm. Several strategies and guiding documents outline evidence-based and population-level strategies that have been proven to reduce harm from alcohol. You can see here the Sustainable Health Review. We've got a little snippet from that that noted there one of their priorities for implementation was the introduction of a minimum floor price for alcohol, which I'll talk about a little bit more. The WA government has several initiatives that go some way to reducing harm from alcohol. For example, WA's unique in having the Alcohol Think Again public education campaign, which informs the community of some of the risks of alcohol harms and how people can minimise their risk. But it's clear that further action is needed. So I mentioned that the Sustainable Health Review in WA recommended a minimum unit price for WA to reduce harm caused by cheap alcohol. So what do we mean by a minimum unit price? It's otherwise known as a floor price, and it sets a price per standard drink below which alcohol cannot be sold. It has the advantages of being a very targeted measure. It lifts the prices of only the cheapest alcohol products. Those cheapest alcohol products represent just a tiny fraction of available products, but they cause a large share of harm. Products this cheap are only sold in some bottle shops. Prices in pubs or bars or restaurants are already well above a potential floor price. Most people wouldn't notice much, if any, difference in prices because light and moderate drinkers rarely drink these very cheapest alcohol products, and if they do, they don't drink much of them. Real-world experience of a minimum unit price has shown it to be effective in reducing harm. For example, over the first year of a minimum unit price in the Northern Territory, where they set it at $1.30 per standard drink, they recorded significant drops in alcohol-related ambulance call-outs, ED presentations, assaults, arrests, road crashes, and child protection cases. So benefits to the community across a wide range of health and social indicators. From the available evidence from the Northern Territory and from Scotland and from other places that have introduced a minimum unit price, it's clear that it's very worth considering in WA, like was recommended by the Sustainable Health Review. So what are we doing to prevent harm from alcohol? So this is a very specific example of some of the work that that I just wanted to preview. So we've been working with other health and community organisations and leaders to bring together the best available information about the harm from alcohol in WA, and we'll soon be sharing a report and other materials highlighting the extent of harm from alcohol in WA. We believe that demonstrating the level of harm is a really important part of creating an environment conducive to further action by governments. So we're developing resources for community organisations to use and share through their networks. So that may include many of you. So you're welcome to get in touch with me directly or keep an eye on the communication channels of Cancer Council WA and Injury Matters and other community organisations who are involved in preventing harm from alcohol, to keep an eye on these resources as they come out. And we certainly welcome you and encourage you to share the info about the level of harm from alcohol in the community through your networks as part of that process of creating an environment where the government can act on some of those evidence-based measures to further prevent harm from alcohol. That's what I wanted to share with you today, but certainly happy to take questions.
Thank you so much, Julia. We've all seen a bit of a rise in alcohol consumption due to COVID. So that's definitely one of the top areas that a lot of health professionals want to work towards. I'll wait for questions to pop in. Please use the Q&A box below to answer any, pop your questions in, and I'll feed that through to the panel, either for Rachel, Kristen, or Julia. I have a question for Julia, actually. So what does partnership actually look like for this policy? Because I know this is something that is definitely on the radar for a lot of local governments. What does that work look like?
Yeah, I mean, there's roles for everybody in preventing harm from alcohol, and particularly in the kind of advocacy policy area. It's been hugely important to work together with a collective voice within our own capacities and working with our own networks. I think there's a lot of similar views about the need for further action, particularly action by governments, to adopt some of those very clearly evidence-based measures. And so working together with a united voice, expressing our concern about the level of harm from alcohol and our collective interest in the government pursuing those evidence-based measures like those that address cheap alcohol is going to be really important. And some groups are more able to do that kind of front and centre vocally. Others may be happy to take a more of a back seat and a behind the scenes role, but there's important roles for everybody. And even if that's just sharing those resources through your networks, that's still hugely valuable.
Thanks, Julia. We might have a question actually. Yeah, this is for Julia as well. What are other countries doing to reduce alcohol-related behaviour? Like, for example, in Europe, is there any examples we can look towards as WA kind of puts this in place?
Yeah, sure. I mean, the three key areas that that are the best buy areas for preventing harm from alcohol are around price. So I've mentioned one of the key policies in that area, minimum unit pricing, and that's certainly taking off across Europe, particularly in the UK and Ireland. They've all recently adopted a minimum unit price, and early evidence coming out of Scotland in particular, who's had it since 2018, is hugely encouraging about how impactful it is in preventing harm from alcohol. The other two best buy areas are around alcohol, restricting alcohol marketing, and there are many parts of the world we can look to who have taken a much stronger approach than we have currently in Australia to restrict alcohol marketing. And that's certainly another area of very strong interest for Cancer Council and many other organisations. And the third area is around availability of alcohol and having appropriate community protections about how alcohol is made available and sold. And I think the most topical part of that at the moment is around online sales and home delivery of alcohol. So those services have really taken off in many parts of the world. Certainly that was already happening, but then there was the pandemic and it increased that even further. And so the business models of the big alcohol retailers have already really moved to selling much more through online sales and home delivery, yet our regulations have not caught up to provide those adequate community protections. So organisations, including Cancer Council, are working with the WA government to encourage them to adopt more of those effective areas to prevent young people getting access to alcohol from home delivery and prevent intoxicated people or other people who may be vulnerable in the community from being harmed from alcohol that's home delivered.
Thank you so much for that. We don't have any more questions, so I might just wrap it up. Give me 2 seconds. Okay, so we do have a number of resources that might be useful for all of you guys in the webinar today. So we have some on alcohol alcohol resource kit, as well as injury stats and a resource kit for that as well. So hop onto our website if you wanted to download them and use them yourself. And we also have a number of events and trainings coming up, some of them in person, some of them online. I encourage you to hop onto our website for that one as well and register if any of them interest you. We have a training coming up on how to alcohol action planning for local governments. If that is something that you're interested in, please register for that one. That's a webinar. In terms of next steps from today, we have an injury prevention network, which is a network that meets quarterly to provide professionals such as yourselves working in the injury prevention space across WA with an opportunity to connect with each other and share learnings and solutions in the injury prevention and safety promotion sector. So if you want to be a part of it, just flick me an email and I'll add you to the list. We also have Connected, which is an online networking program for professionals working in the injury prevention space. It is a networking program where people are paired with another health professional in the injury prevention space who can, it just takes networking, just makes networking easier. If you're interested, there's a QR code on the screen there. You can read more and register to it. And also evaluation, we'd love to hear about what you thought about today's webinar. When the webinar ends, you'll get a survey pop up on your screen. We'd love to hear about what you thought about today and any ideas for future trainings as well. We'd love to hear from you. And that's it from me today. Thank you all. Thank you all to the speakers, Julia, Kristen, and Rachel. Thank you all for your time. Yeah, thank you all. Have a good day.
Great. Thanks, Apu. Thanks for organising and for the opportunity